Welcome to My Long Island TV. From Manhasset to Montauk, we have traveled our communities to bring you the following events. I'm your host, Waldo Cabrera. My Long Island TV starts now.
So today is a party that we're having to celebrate Allied Physicians Group and to announce the launch of our new foundation. As physicians and running a medical practice, we're really trying to set ourselves apart in the quality and the care that we bring to our families, and who does this better than Disney.
When you go to a Broadway show in New York City, is the person who pulls the curtains important to the show?
I actually read the If Disney Ran Your Hospital book and loved the philosophy, and so we invited Jake to come and help us raise to that level for our offices. It's not like Mickey Mouse is going to be running around. It's really the customer service, caring for our families as well as caring for our staff and having a culture of caring, basically. Everybody pitching in, working as a team, going above and beyond.
The average guest, 79% of them, will come back every 3 years. Wait for it, for life. So Disney's garnered something. They connect here first.
Medicine now, there's a lot of competition. There's competition from hospitals. Health insurance companies are buying physician practices. There's urgent care centers on every other block. So we need to differentiate ourselves. We need to make our patients happy. Keeping them happy makes them healthier too. They're more likely to listen to you. They're more likely to follow up when they need to follow up, fill their prescriptions, on and on and on.
I said an average employee will get 40 to 80 hours of training every year just in service, not in operational job tasks. Oh my gosh! 100,000, 65,000 cast members, 35,000 contract employees. What if you train these people and they leave with all that great training? You know what I said? What if we don't train them and they stay?
Healthcare and Disney are very different. People look forward to going to Disney. They save money to go to Disney. They don't look forward to going to the doctor, and they don't save for an accident. So they have different emotional needs. However, when they get to us, they have the same needs. They want to be treated as a VIP, not a very important person like in business, but a very individual person.
Have you put the computers in the corner of the exam room so you literally have to turn your back on your patients when you talk to them? Do you know that they don't trust you as much as if you turned around and talked to them first?
So what I try to do is A, keep it simple. 2, involve the staff in developing the playbook. So if they're not part of it, they feel like it's imposed on them, and you've been telling them they're doing wrong for 30 years.
How's your waiting area? Whose job is it to clean the waiting area after 13 patients have been roomed and they've left newspapers and cups and so on? Well, it's everybody's job, Jake. Really? Whose job description is it? Well, anybody can do it. I know anybody can do it, but who's actually getting it done?
Patients aren't patient anymore. And the new millennia, the kids that I'm raising, are even less patient than you and I. At least I'm a baby boomer, and I did what the doctor told me to do. But if you tell me to have a seat after I've already filled out my paperwork, and it'll be any moment now, or we'll be with you shortly, I give you 10 minutes. Keep me in the loop.
You're not Disney World. You're not riding rides. People don't look forward to going to you, but when they do, can you manage the entire experience, not just the clinical pathway?
Disney's not the best at rides, but what Disney's really great at is managing the wait time experience. I could do a whole nother workshop on positive distractions in wait time management.
The thing that stuck with me is connecting every piece of the patient experience. So from the moment the patient's parking to when they first walk into your practice, when they have the clinical interaction and they leave and follow up later.
You got to map it out, not just to make sure we're getting good handovers and handoffs. You got to make sure everybody's delivering on the promise of the care team.
One of the things that I like is about team handoff, so that when I hand a patient off to the doctor, when I hand a patient off to billing, when I have them go speak to the front desk, I'm going to speak to my team member first and say, this is Mrs. So-and-so. She wants to discuss this with you, so that they're on the same page as me and they're set up for success.